Has someone you love begun to show small but worrying changes over the past year? Many people think that old age ends suddenly, but the truth is that the body often gives quiet warnings months, or even a year, before life reaches its final stage. The problem is that most people miss these signs because they seem small at first. Only later, when you look back, do families realize the clues were there all along. But by then, it is too late to plan ahead and too late to make those last memories count. In this video, we are going to talk about 5 important signs that usually show up in the year before an elderly person passes away. Some of these may be things you have noticed but thought were just part of aging, while others might seem minor yet really show that the body is slowly shutting down. Noticing these signs early gives you a chance to give better care, create special moments, and most of all, make sure your loved one's final time is full of comfort, dignity, and peace. Stay with us until the end because these 5 signs can help you get ready emotionally and practically for what lies ahead. When you know what is happening, you will not be caught off guard, and you will be able to use the time you have left with those you love in the best way possible. Now let's get started. Number 1. Unwanted weight loss. One of the first and most clear signs that someone may be in the last year of their life is losing weight without trying. At first, it might seem small, a belt that needs an extra notch, looser clothes, or a once strong appetite that starts to fade. Many families think it is just a part of getting older, but losing weight on its own is rarely a good sign. It often shows that the body is no longer absorbing food well, muscle is getting smaller, and important systems are slowing down. While aging naturally makes you lose some muscle, if it happens too quickly, it means something deeper is wrong. The body might be having trouble digesting food or processing protein, which can lead to muscle loss. This loss of strength does not only make moving harder, it also increases the risk of falling, weakens the immune system, and makes the person more likely to get sick. Another reason for weight loss in the last year of life is that many older people simply do not feel as hungry as before. Their sense of taste fades, food does not seem as tasty, and they may begin to skip meals or eat much smaller portions. This is not just a matter of liking or disliking food. It is a natural change as the body starts to shut down and no longer tells the brain to ask for food. The result is less energy, less strength, and a slow decline in overall health. There is also the impact of long-term illnesses, as weight loss is a common sign of diseases like cancer, heart failure, or kidney problems, which can slowly get worse long before other symptoms appear. Even depression or memory problems can cause a person to eat less, starting a cycle where the body does not get the fuel it needs. Some families try to help by encouraging their loved ones to eat more, offering favorite meals, or adding protein drinks to their diet. But if the weight continues to drop despite these efforts, it is important to understand that the issue is not just about diet, it is the body preparing for a deeper change. At this point, forcing large meals may not help. Instead, focusing on soft, easy-to-eat foods and making sure they stay hydrated can improve their quality of life. If you see a loved one losing a lot of weight, eating less, feeling weaker, or having trouble staying active, it is time to take notice. This is not just about how they look. It is the body sending a message. Understanding that message now can help you plan for the road ahead with clarity, care, and the chance to make every remaining moment count. Number 2. Extreme fatigue and weakness. One of the most obvious changes in the year before the end of life is a deep, ongoing tiredness that does not get better with rest. It is not just a bit of tiredness after a long day. It is a strong exhaustion that makes even simple tasks seem very hard. Getting out of bed becomes a challenge, walking across a room takes effort, and things that used to be easy, like cooking, dressing, or having a conversation, start to feel too hard. This is not just because of normal aging. It is a sign that the body is saving its remaining energy as its organs slow down. The heart does not pump as well, circulation weakens, and muscles do not get as much oxygen as before. That is why many older people in their final months feel weak, unsteady, and cannot do as much as they used to. Another reason for this tiredness is that the body's metabolism slows down as it gets ready for its last phase, shifting energy away from movement to save power. This is why someone who is declining might sleep more, need longer naps during the day, and have trouble staying awake for a long time. Sometimes they may seem fine one moment and then suddenly be completely drained the next. Perhaps the most sad part of this change is the emotional toll it takes. Many seniors who once valued their independence start to feel frustrated or embarrassed that they cannot do what they used to. They may begin to withdraw from conversations, avoid social gatherings, or stop doing hobbies, not because they do not care, but simply because they lack the energy. This can lead to a cycle where they try less and become more isolated, which only makes their condition worse. For families, watching a loved one go from being active to constantly exhausted can be very painful. It is easy to think they are just being lazy or that they should push through the tiredness. But the truth is that forcing them to be active will not help. What matters most is understanding their limits, letting them rest when they need to, and making sure their remaining days are as comfortable as possible. If you notice a loved one with deep, ongoing tiredness that does not improve with rest, take it as a sign that their body's going through a major change. This is the time to have quiet talks, create peaceful moments, and support them without expecting too much. In the end, what matters is not how much they can do, but that they feel loved, understood, and at ease. Number 3, cognitive confusion and withdrawal. As a person reaches the final stage of life, you may see changes in how they think, talk, and interact with others. You might notice that someone who used to be sharp starts to forget things more often or has trouble following conversations. They may seem confused even in places they have known for years, repeating themselves or forgetting names and dates. This is not just everyday forgetfulness. It is because the brain, like any other part of the body, needs a steady flow of oxygen and nutrients to work well, and that flow slows down. As the brain gets less oxygen, the person may become easily confused, have difficulty making decisions, or struggle to recognize people and places they once knew. In some cases, they might even have short moments when they seem clear, followed by sudden confusion, almost as if their mind is fading in and out. Another common sign is emotional withdrawal, where someone nearing the end of life starts to lose interest in social activities. You might notice them speaking less or spending long periods sitting in silence. It is not that they do not care about their loved ones. Rather, their brain is not handling emotions and conversations the same way it once did. You may also see changes in mood and behavior, with some people becoming more easily frustrated, anxious, or irritable, while others seem unusually calm or detached. This is not a change in their true personality, but a sign of the brain adjusting to the overall decline in the body. For families, this stage can be very hard, as watching a loved one lose touch with reality or pull away emotionally can feel like losing them early. It is important to remember that these changes are not something they can control. Instead of trying hard to bring them back to their old self, the best approach is to meet them where they are, speak gently, and offer reassurance. Even if they do not always respond, they can still feel your care. If a loved one is becoming more forgetful, confused, or withdrawn, do not ignore these signs. They are early hints that the body and mind are getting ready for the final transition. This is a time to be patient, to enjoy quiet moments together, and to create a safe and familiar environment where they can feel at peace. Number 4, frequent infections and slow healing. As the body starts to wind down, one clear sign is that the immune system becomes weaker. You might notice that someone who rarely got sick before now seems to catch every cold, flu, or small infection that goes around. Illnesses that used to be minor now take much longer to get better, and even small cuts or bruises heal at a slower rate. These changes are not random. They show that the body is no longer able to fight off infections or repair itself as it once did. One of the biggest concerns is that repeated infections, like pneumonia, urinary tract infections, skin infections, or even mouth infections, become more common as the immune system fades. Many families think these illnesses are just isolated events, but when they happen frequently or take a long time to clear up, it is a sign that the body is losing its ability to fight back. Even antibiotics, which once worked quickly, may seem less effective, and the person might need stronger or longer treatments. This happens because as circulation slows and organs decline, the body cannot respond to treatment as well as before. Another problem is that small scratches, sores, or bruises may not heal properly or keep reopening, which can mean that circulation is poor. Poor blood flow means that oxygen and nutrients are not reaching the skin and tissues efficiently, slowing down the healing process. Pressure sores, especially in those who do not move much, become a serious risk and can lead to dangerous infections if not managed carefully. What is even more concerning is that in the final year of life, infections may not look the way we expect. Instead of a high fever, an elderly person might simply seem more tired, confused, or less interested in eating. In fact, a sudden drop in mental alertness in seniors is often the first sign of an infection, even before other symptoms appear. Recognizing these changes early can make a big difference in how much comfort and support your loved one receives. For families, watching a loved one suffer through repeated infections can be very heartbreaking. It is tempting to push for more aggressive treatments, like another round of antibiotics or another hospital stay, hoping for a cure. But at some point, the focus shifts from trying to cure the illness to keeping the person comfortable. Making sure they stay hydrated, keeping their skin clean and moist, and reducing stress on their body can help more than additional medical interventions that only prolong suffering. Number 5. Changes in breathing and circulation. One of the most clear signs that the body is preparing for its final stage is a change in breathing patterns and circulation. You may notice that your loved one starts to breathe more slowly or shallowly than before. At times, they might pause between breaths, or their breathing might become irregular, speeding up and then slowing down unexpectedly. Some people even experience a gentle, rhythmic breathing pattern where deep, rapid breaths alternate with long pauses, known as Cheney-Stokes respiration. These changes might start very subtly, but over time they become more obvious and frequent. Another common sign is weakened circulation. You may notice that their hands, feet, or even their nose and ears feel cold to the touch. The skin may appear pale, bluish, or mottled, especially around the fingers and toes, because the body is sending more blood to the vital organs. This shows that the heart is not pumping as strongly as it once did. Some people may also experience shortness of breath with even minimal movement, such as sitting up, talking, or shifting position. They might start breathing through their mouth more often, or suddenly need to pause and catch their breath during conversation. If they were once able to walk across the room easily but now struggle to do so, it is a sign that their lung function is declining. In some cases, fluid buildup in the lungs can make breathing even more difficult, causing a persistent cough, gurgling sounds, or a feeling of tightness in the chest. Many people assume these symptoms are just a bad cold, but in elderly individuals nearing the end of life, they are often a sign that the lungs are weakening. This can make lying flat uncomfortable, and they may prefer to sleep propped up on pillows or in a recliner to ease their breathing. For families, seeing these changes can be frightening, and it is natural to want to help by encouraging deeper breaths or worrying that something urgent is happening. However, in many cases, these changes are simply the body's natural way of slowing down. There may not always be a way to reverse these changes, but there are ways to make them more comfortable, such as keeping the room cool, using a humidifier, or offering small sips of water. Sometimes medications or oxygen therapy can help, but the focus usually shifts toward making the person feel comfortable rather than trying to fix the problem. If you notice these changes in breathing, cold hands and feet, or a bluish tint to the skin, pay attention because they are signs that the body is conserving energy and circulation is slowing down. This is the time to be present, to offer reassurance, and to create a peaceful environment where your loved one feels safe and at ease. Remember, the most important thing you can give them is not medical intervention, but comfort, dignity, and the knowledge that they are not alone. Final thoughts. As we come to the end of this video, take a moment to think about what we have discussed. Significant weight loss, extreme fatigue, cognitive decline, frequent infections, and changes in breathing and circulation. These 5 signs often appear in the year before an elderly person passes away. They may not all happen at once, and they might not be obvious at first. But when you start to notice them, it is a sign that the body is getting ready for its final transition. For many families, these changes can be hard to accept, and it is natural to want to fight against them by trying to make a loved one eat more, move more, or push through exhaustion. But sometimes the best thing you can do is listen to what the body is telling you, rather than trying to stop the inevitable. Focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs is not about being afraid of death. It is about being prepared for it. When you recognize these changes early, you can provide better care, make important decisions ahead of time, and ensure that your loved ones' final months are filled with love and dignity. This is a time for cherishing moments, sharing stories, and reminding them that they are valued and not alone. If you notice these signs in someone close to you, take a deep breath and remember that you are not alone in this journey. Many families have walked this path before, and while it is never easy, knowing what to expect can help you find strength, patience, and peace. Thank you for joining us today. We would love to hear from you. Please leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to us, so do not hesitate to share them, as reading your comments gives us great motivation and encouragement. If you enjoyed this video and found it helpful, please like, subscribe, and share, as your support helps us continue to create good content that informs and inspires. Thanks for watching, and we look forward to seeing you in the next video.